everybody, welcome back to my channel. It's Crystal Divine, and today I'm going to talk to you guys about due date and the accuracy of due dates. Okay, the most interesting thing that I found out about due dates is that there's only a 5% chance of your due date actually being accurate. That was like to me, and you know, the phrase is just misleading. And it kind of just gives off the impression that our due date is accurate. Like when we find out we're pregnant, that's one of the first things we want to know. Okay, when is the baby due? And then the countdown begins from there. But I personally feel like a due date should be more of an estimation. Like when they give us a due date, they should be referring to it as, you know, hey, this is just a window. This is an estimate. Your baby will come around this time. And I feel like that because I did a lot of research on due dates, and I found out just how, you know, your due date is calculated. So we all know that they go by our last menstrual cycle to calculate when the baby will be due. They also do this by a sonogram or an ultrasound, but even those two methods produce different results. That actually happens very often. And I know I kind of like just jumped right into this video, and you might be wondering like, okay, well, you know, what's the big deal if the baby isn't born on the actual due date? Well, here's the thing. It's important to know this because a due date acts like a medical deadline, and it gives physicians and hospitals the permission to treat your due date as, not your due date, but it gives them a reason to treat your labor and your delivery as a medical emergency. Now, think about why you go to a hospital. You know, someone goes to the hospital because they're hurt, they're sick, they're dying, there was some kind of accident, or there's some type of trauma. Childbirth doesn't fall under any of those categories. Now, I personally can't think of another reason why I would go to a hospital. So if you can, by all means, drop that in the comments. But childbirth just doesn't fall under any of those 5 things that I just named. So there has to be some reason for physicians and hospitals to be able to intervene medically in your childbirth. You understand what I'm saying? So as soon as your due date comes and goes, you're overdue, and now they have a reason to want to induce your labor. And it's true, y'all, because if you go over your due date a week, they start talking about what they're gonna do. If you manage to go over your due date 2 weeks, they're like putting the pressure on you to get induced. Now, here's my whole contradiction, y'all, because a baby is likely to come anywhere between 37 to 42 weeks. And once you are 40 weeks, this is about where your due date is. If you go past this, you're considered overdue, and you're in like this danger zone for being able to deliver a healthy, safe baby. But 60% of babies are born a week after their due date, and 90% of babies are born 2 weeks after their due date. And keep in mind that these are statistics that I have researched for women out there who have low risk pregnancies. Okay, so if 37 to 42 weeks is considered full term, and there's only a 5% chance that your due date is accurate, and it's not uncommon for a woman to go past 40 weeks, why are they in such a hurry to jumpstart your labor? Like, why are they in such a hurry to make us have a baby? I'm telling y'all, the due dates act as a reason for them to treat our labor and our delivery as a medical emergency. So from the last menstrual cycle, what physicians do is they add either 40 weeks or 280 days, and that is how they come up with your due date, estimated due date. The problem with this method is that it assumes that your cycle is a 28-day cycle. Now, the second way is through the ultrasound, and the ultrasound basically just measures the size of a fetus, and they take that measurement and calculate estimated due date from that. Okay, here's what you might not know. If those two calculations differ for more than a week, then physicians will automatically go with the ultrasound due date versus the calculated due date based off your last menstrual cycle. Ovulation is not mechanical, okay? It's not like clockwork, and it varies from woman to woman, and it even varies from cycle to cycle based on that woman. That's my concern with, you know, calculating your due date by adding on the 40 weeks or the X amount of days. The thing for me about ultrasounds and sonograms is that it's supposed to be the earlier that you get one, the more accurate that it is. And a lot of times women, black women, okay, we don't get our first ultrasound early. Like, that does not always happen for us. Sometimes we don't get that first ultrasound till the second trimester. Like, let's just be real. And the thing about ultrasounds is the earlier you get one, the more accurate they are supposed to be. As your pregnancy progresses, the ability for it to produce an accurate due date lessens. It decreases, and it only becomes beneficial for measuring the size of the fetus. But even these measurements are just estimates as well, because how many times have you been heard, or how many times have you been told your baby weighs 7 pounds and then you give birth and your baby's like 5 pounds? Or, you know, it's higher. Your baby's going to be 6 pounds and you give birth to a baby that's pushing 8 pounds. So my point is that due dates are not accurate versus ultrasound or sonogram or a birth calculator, okay? But why does all of this matter? It matters because our physicians lead us to believe that if we don't give birth by a certain due date, then our baby is in danger, or we're in danger of not being able to have a safe delivery or labor. So if your estimation is off just by a couple of days, let's just say that. Because some of you might be thinking like, okay, well, you know, my baby came just a couple of days before or after. So if your due date is off by just a couple of days, then that puts you in the category of women who are post-term or past 42 weeks. And because you're now in this category due to this inaccurate due date, now you're being pressured to be induced, when in reality, there's no reason for you to be induced. You're not overdue. You're right on time. You're right on schedule. And we just need to let things flow. Your baby and your body will let you know when it is time. Now, some of us are okay with, you know, being patient and waiting, you know, and then some of us are not, especially first-time mothers. Like, so yeah, true, some women are okay, you know, waiting and just letting nature take its course. And then other women, we tend to develop anxiety about our due date, especially first-time moms, you know, like when our due date approaches, we have it in our mind, okay, I got 1 week left, I got 2 weeks left. Like, how many times have you ran into women who were pregnant and they say, when you do? And they start counting down, I got 3 weeks left, girl. You know what I'm saying? And then so that 3 weeks passes and it's like, all right, any day now, this is the week, any day now. And then that week goes by. And then you have physicians telling you, we probably should schedule an induction if the baby isn't here in 5 days. And those pressures get to us because we don't want anything to be wrong with our baby. We don't want the chances of us having a safe and healthy delivery experience tainted, you know? So those people who have on those white coats, that authority, we automatically just run with whatever it is that they're telling us, because we're not properly educated on childbirth and how the process really works. If you know better, you do better. But since we don't know any better and we're listening to these physicians, we're more likely to change our whole birth plan, our whole idea of what we wanted for our birth experience, all because we've passed our due date and they're saying that we need to let them induce our labor. for no other reason. Keep in mind that this video is geared to women who are low risk pregnancy women. Okay, they are low risk pregnant women. Okay, I'm not talking about women with complications and all that, because that changes the whole dynamics of things. But majority of the women who are giving birth are low risk, and this is what this video is geared to. And when you really think about it, is it necessary to even induce a woman's labor if her due date is only 5% chance of being accurate? Like, when you really lay all the facts down on the table, stuff just doesn't really make sense. It doesn't really add up as far as being the decisions that are being made in the best interest of me and my baby. The only facts here is that no one can pinpoint your due date. No one. There's no technology out there that can give you a precise day of when your baby is going to come. No one has figured out the science behind it. Women, our cycles, ovulation, fertility, all of that is unpredictable. And it's not even that it's unpredictable, it's just too complex, and it varies from woman to woman. It even varies from pregnancy to pregnancy with the same woman. We never have the same birth experience twice. We just don't. So I encourage women, pregnant women, to take that due date from your doctor and look at it as a due month, or maybe a due season. You know, that way, if you do become overdue, you don't feel the need to panic, because you already know this due date that they're giving me has a very, 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 very low chance of actually being accurate. Most of the time, women go past their due date. Remember, full term is considered anywhere from 37 to 42 weeks. Okay? So there is really no reason to worry, again, if you have had a low risk pregnancy. Unless there is some indication that there is a problem, these last few weeks, we need to be relaxing. We need to be taking it easy. We need to be patient with our body and our baby, because if any woman out there has been pregnant, the end is rough. And you know, these physicians, they know that. So they kind of count on that when they pressure us to consent to an induction, you know, and that's not fair. And I do have one big issue that I want to address, because a lot of times we're told that after a certain point there is a risk that your placenta will dry up. They will tell us that our placenta will literally deteriorate. The amniotic fluid will decline, or that your baby will pass a bowel movement, and your baby will begin practicing to breathe, and the bowel movement, which they like to refer to as Maconin, can get into the lungs and create breathing problems for your baby. This may be a scenario that can absolutely happen, but we have to know that it is extremely rare, and your placenta is not going to dry up. There has to be something there has to be something really, really wrong for your body to work backwards like that. Remember, your body and your baby, they know when it's time. So even if your placenta is drying up or deteriorating, or the amniotic fluid is starting to decline, that's a signal to your body that it's time to deliver, and you'll probably go into labor. You're gonna go into labor before all of that happens, unless something really serious is going on with the mother's health, or the mother, you know, is on drugs, drinking alcohol during her pregnancy, on medications that she probably shouldn't be on, or doing something to create a problem. This is very rare, and it's probably not going to happen to you. But because it could, just because there is that little teeny tiny possibility, they might use that to intimidate us and put fear in us and get us to consent. Okay, so I just wanted to address that one big issue, because that really grinds my gears. No, I'm just playing. But yeah, that's pretty much all that I have to talk to you guys today about due dates. I just wanted everyone out there to be aware how accurate they are, and to look at them again like a due date, a due month or a due season, okay? And trust in your body, have faith in your body and your baby to just work the way nature naturally flows. If you are again a low-risk pregnant woman and you become overdue, do not panic. Most women deliver babies between 37 and 42 weeks, and honestly, that statistic would probably be wider if we weren't being induced so much. If women were allowed to just give birth whenever their body says they're ready, we would probably be amazed at how much longer past 40 weeks we would stay pregnant before we went into labor, okay? So thank you guys again for tuning into my video. I hope this video was very informative for you guys, and I just hope that, you know, it opens up a perspective in your mind, and moving forward in the future, you will not take those due dates so seriously, because it's a 5% chance of ever being accurate, okay? So don't allow these physicians and these doctors and these hospitals to intimidate you if you become overdue. And thanks again, guys, for tuning into my video. Until next time.